Our next question is how can we use a CFD model to assess the safety of experimental therapies? Well, a model is only as good as its underlying assumptions. In the previous video, we looked at a model that assumed two identical patients using the same resistance and compliance values for their lungs. So the pressure and flow rates are symmetrical. But what happens when we relax this assumption? In this simulation, patient 1 on the left has the original healthy lung parameters. However, patient 2 on the right has a pre-existing pulmonary condition, in this case, chronic obstructive pulmonary disease, or COPD. COPD has been identified as a condition which puts a patient in the high-risk category for COVID-19, so it stands to reason that a higher proportion of those patients would need ventilator support. So let's look at the flow rate data. We can see that patient 1 is receiving a significantly higher flow rate of air. That corresponds to almost double the total volume of air taken into the lungs during inspiration. It would seem that we need to use some sort of diverter valve to regulate the flow to these two patients. However, this sort of conclusion can be drawn pretty easily from a clinical setting or from a 1D model. A question that CFD is well positioned to examine uniquely is the issue of cross-contamination. Here we are looking at the streamlines of velocity during the inspiration phase of the respiratory cycle. We can see flow coming in through the ventilator and splitting at this valve to go towards the two separate patients. However, because our patient's lungs are not responding identically to the flow, we can see that some of the flow is bypassing our patient and going through the exhalation tube. And ultimately, this flow is able to come down to the Y-split where these two tubes join and go up towards the other patient. During a subsequent number of cycles, it's potentially possible that this flow could represent contamination that passes from one patient to the other, which can have an impact on the patient prognosis. To verify that, I ran a passive scalar test. This is a numerical tracer that's meant to represent the potential movement of virus through our domain. Here we can see that after going through several breathing cycles, there's a significant amount of the tracer at the other patient's breathing tube. So I think we can conclude that this setup with these patients poses a significant risk for cross-contamination. Subsequent work could use simulation to understand the sensitivity of the patient's resistance and compliance in their lungs to determine which patients could be matched together safely and which would require modifications to the setup of the disposables here.